When a new variant of the virus enters a community and people don't have immunity to that virus, then cases can increase rapidly. And particularly with this Delta variant, it's more infectious than the previous versions of the COVID-19 virus, and so it's caused a great number of infections in a short period of time. And that's what we're seeing now is rapid increase in the number of cases in our community and subsequently rapid increase in hospitalizations. Yeah, so the Delta variant of the virus that causes COVID-19 is much more easily transmissible than previous versions of this virus. It's at least 50% more transmissible than the Alpha variant, which was itself more transmissible than the original virus that causes COVID-19. This is, appears to be for a couple of reasons. The Delta variant has a mutation that causes it to be replicated at a much higher rate when someone develops infection. It also is easier for that virus to enter the cells of a person that becomes infected, so that if you become exposed, you more easily develop infection and then more easily pass that infection on. So what happens when somebody gets infected with this virus is that their respiratory cells begin to make copies of that virus. That's what a virus does. It causes its host to make more copies. So when an infection happens, millions of this virus are being created. And it's just making copy after copy after copy, and sometimes there are mistakes in that process. And usually what happens is that when there's a mistake in that process, it causes that virus to die, and that virus isn't able to then move on and infect other people, and it becomes less effective. But every now and then, that mistake actually causes the virus to be more easily transmissible or to make more copies of itself once it infects the host. And so that's what happens with these variants, like the Delta variant, is there's been a mistake in the process as that virus is being copied that actually made it worse and more easily transmissible to a point that it's now becoming the dominant strain of the virus worldwide.